Sartorius muscle arises from the anterior superior iliac spine and descends obliquely downwards and medially in front of the thigh, forming the lateral boundary of the femoral triangle. It continues on the medial side of the thigh, where it lies on the roof of the subsaltorial or abductor canal. The sartorius is inserted below into the upper part of the medial surface of the tibia, together with the two other muscles named the gracilis and semitendinosus. The three muscles lie superficial to the tibial collateral ligament of the knee. The muscle is supplied by a branch from the femoral nerve. This is the branch of the femoral nerve entering the muscle. This is the tensor fascialis. It arises just lateral to the origin of the sartorius. It arises from the anterior 5 cm of the outer lip of the iliac crest and descends lateral to the sartorius to get inserted into the anterior border of the iliotibial tract. Actually, the muscle lies in between the two layers of the iliotibial tract and does not extend downwards below the upper fold of the thigh. It is supplied by the superior gluteal nerve. Note that the posterior border of the iliotibial tract gives insertion to most of the gluteus maximus muscle. The tensor fasciae lata and the gluteus maximus pull on the tract, making it tight during extension of the knee. Notice that in the interval between the upper part of the sartorius and tensor fasciae lata, notice that in the interval between the upper part of the sartorius and tensor fasciae lata, the tendon of the rectus femoris muscle lies. This tendon arises by two heads: a straight head from the anterior inferior iliac spine and a reflected head from a groove just above the acetabulum. The rectus femoris muscle is ahead of the quadriceps femoris, and the remaining three heads are formed by the three vasti. This is the vastus lateralis muscle. It lies deep to the iliotibial tract. This is its nerve supply, which is a branch from the femoral nerve. It runs in company with the descending branch of the lateral circumflex artery. The vastus lateralis and the rectus femoris muscles overlap the vastus intermedius muscle. This is the nerve supply to the vastus intermedius. It comes from the femoral nerve. This is the vastus medialis muscle, and this is its nerve piercing it. It is again a branch from the femur. This is the medial side of the vastus medialis, showing its nerve entering its substance. and the direction of its fleshy fibers. The fleshy fibers of the Vastus Medialis reaches down to a level lower than that of the Vastus Lateralis. The lower fibers of the Vastus Lateralis are more vertical, while those of the Vastus Medialis are more horizontal. These are the lower horizontal fibers of the Vastus Medialis, which are attached to the medial margin of the patella. These fibers prevent lateral displacement of the patella during extension of the knee. The Vastus Medialis forms the lateral boundary of the Abductor canal. The quadriceps femoris muscle as a whole is inserted into the patella, and from the patella to the tuberosity of the tibia through the ligamentum patelli. This muscle is the only extensor of the knee joint, as opposed to the three hamstring muscles situated on the back of the thigh, which are the flexors of the knee. These are the muscles of the floor of the femoral triangle. They are from lateral to medial, the Idiosaurus, Pictoneous, and Abductor Longus. This is the Idiosaurus. It is formed by both of the iliacus and psoas major muscles, and is inserted into the lesser trochanter of the femur. It is the main flexor of the hip joint, as opposed to the gluteus maximus, which is the main extensor of the hip. Notice that the femoral nerve appears behind the inguinal ligament and descends on the surface of the Idiosaurus. The femoral artery also descends in front of the Idiosaurus, which intervenes between it and the hip joint, that is to say, from the head and neck of the femur. This is the Pictoneous Muscle, just medial to the Idiosaurus. It arises from the pectineal surface of the superior ramus of the pubis and from the pecten pubis. It is covered by pectineal fascia and is related anteriorly to the femoral vein and femoral canal. It is inserted in of the spiral line extending from the lesser trochanter to the linea aspera. It is supplied by the femoral nerve and by branch from the obturator nerve. This is the Abductor longus muscle, just medial to the pectineus. It arises from the front of the body of the pubis, just below the pubic tubercle. The gracilis muscle lies medial to it. Therefore, the Abductor longus lies at its origin between the gracilis medially and the pectineus laterally. The Abductor longus is the most superficial muscle of the three abductors. This is the Abductor longus. This is the Abductor brevis. And this is the Abductor magnus. All abductors are supplied by the obturator nerve, and we shall come to this soon in more detail when we describe the medial side of the thigh.